A temporary halt in fighting, but the suffering in Gaza is far from over. Facing mounting international pressure and global outrage over starvation deaths in Gaza, Israel has announced a daily 10-hour pause in military operations in select regions of the enclave. This comes as Jordan and UAE resumed humanitarian airdrops for the first time in months amid chilling images of starving children and shattered hospitals. The Israeli military will also allow aid convoys to travel along secure corridors from 6 a.m. to 11 p.m. daily. The aim, Israeli officials say, is to enable humanitarian access, but on the ground the crisis remains catastrophic. Gaza's health ministry says 133 people have died from hunger, including 187 children.
This is how a child starves. Experts say starvation is not only killing children in Gaza, but will cause lifelong harm to those who survive.
Malnourishment is one of the worst things that can happen to a child, at point blank. And
though Gazans of all ages are suffering and losing their lives, aid groups say, there's a 1,000-day window from conception to 2 years of age that is crucial, according to Kirk Pritchard of Concern Worldwide.
If you're severely acutely malnourished during that time, or even if you're moderately acutely malnourished at that time, you're going to have a lower IQ likelihood. You're going to have lower height. You're going to have lower weight. It's going to affect you for the rest of your life.
More than 100 organisations have said mass starvation is spreading in Gaza because of Israel's aid restrictions, even as tons of food and other supplies sit untouched just outside the enclave. 4-year-old Amir Matar weighs just over 16 pounds. He has cerebral palsy, and so does his 6-year-old brother Yusuf. Their mother Samah says she struggles to find milk or even bread to feed her 6 children, who live in a Gaza City school-turned-shelter. And she can't comfort Amir.
Mum, we don't have bread. Mum, we don't have bread. Mum, we don't have bread. I say don't move so much so you don't waste your calories and get hungry, but he doesn't get it.
The UN's World Food Programme says nearly a quarter of Gaza's 2.1 million Palestinians face famine-like conditions, and thousands are suffering acute malnutrition. The first damage to a child with malnutrition is counted in days. A child's brain develops at its fastest rate in the first 2 years of life. Pritchard said chronic malnutrition among mothers, especially young mothers, can cause low birth weight and a decrease in the quality and quantity of breast milk. Diseases that a healthy child would resist can kill, he says.
One of the things we're really worried about in malnourished children is diarrhea, which can actually then go on to kill them within that as well. Your immune system starts to shut down, so you can't fight off basic infections. Your organs are affected. Everything about, especially once you get to that severe acute malnutrition aspect of things, every aspect of a child is affected by it. Their cognitive development, their brain development, everything.
Israel cut off all supplies to Gaza from the start of March and reopened the flow with new restrictions in May. It says it is committed to allowing aid in, but must control it to prevent it being diverted by Hamas. Hamas denies doing this. Israeli government spokesperson David Mencer.
In Gaza today, there is no famine caused by Israel. There is, however, a man-made shortage engineered by Hamas.
Amber Alayan is a paediatrician with Médecins Sans Frontières, which she says has scores of people working in Gaza.
We're seeing 1 in 4 of our kids, being treated in our clinics with malnutrition. It just seems to get worse.
Those numbers are shocking, she says, even compared to other countries where malnutrition is rife, like South Sudan or Congo.
The biggest issue that's very acute in the childhood period, though, is things like developmental delays. So it stunts their growth and it stunts their brain growth as well. So they can have issues with speech delays or reading delays, or even just like relationship delays with their parents. And there is another component of that, which is the bonding between parents and children, that there is a break in that bond somehow due to some of these developmental delays in early childhood malnutrition.
Najah Barbach cradles her daughter at a hospital in Khan Yunis. She doesn't grow, she says. She should be able to sit up straight. She lies on her back, and that's all. Pritchard says the impact on young ones is obvious and devastating to see.
And I think the thing that gets you the most when you see it firsthand is how quiet they are. You can have 30 2-year-olds, 1-year-olds in a clinic, and you can hear a pin drop. And it's just because it's absolutely eerie, and it's heartbreaking to hear that the quietness of it.